what your role is as far as healthcare information records and how you implement them within the hospital systems.
Yeah, sure. So the way I found this position too is this is an interesting one about building bridges too. I was working for Cerner as a project manager, and what we would do is we would work with hospitals that are about 100 beds or less and implement Cerner's solutions, basically their software. And to
Yeah.
make the analogy is picture Microsoft Office with Word and Excel and PowerPoint and all the different solutions that work within Office. We do that with Cerner solutions, whether it goes in the radiology department, the pharmacy, materials management, whatever, and they all work together. And so that led me to meet a gentleman that was on a client site to the position that I have now. And so what we do is we project manage from the client's perspective. So
Okay.
we're on the client, we're representing the client side now, not necessarily Cerner, who is the vendor.
Right.
And we make sure that that project stays on task. We help mitigate risk. We help deal with resources because people are changing all the time. We
Hmm.
help with the communication plan because sometimes people learn and get information in different ways, whether it be email or postings in the break room or podcasts or community advisements. There's a
Right.
whole bit of different things, a whole lot of moving parts. So that's what we're doing on a daily basis.
So then, are you in the hospitals individually? Okay. So
Oh
then,
yeah.
while you're in the hospital, who are you having those one-on-one conversations with specifically? Is it a nurse manager, a physician, a hospital manager, or how does that kind of all
Sure.
work out?
It usually starts at the C-suite level. And what I mean by that is it's either the chief information officer, the chief financial officer, sometimes the CEO, the chief executive officer. It'll start with that level, to make sure that we're all on the same page. But
Right.
then if you're roaming around, you know me, I like talking to anybody. So I will talk to anybody from an end user who could be a nurse, a care provider,
Yep.
a doctor that's having trouble entering their note. I could talk to somebody in materials management that's having trouble scanning an item, to make sure it's in the system. So a care provider could use that saline solution or use that Tylenol or those crutches or whatever. So
Right.
I keep the door open to talk to anybody.